Welcome to today's webinar entitled Cardiopulmonary Resuscitation and Blood Gas Sampling during CPR, and thank you for tuning in. My name is Jake Wolf, and as you heard, I am a first-year emergency and critical care veterinarian at the University of Pennsylvania, and I look forward to any questions you might have at the end of the presentation. Just as a brief overview, this presentation will cover 5 steps or 5 different components of cardiopulmonary resuscitation. First, recognition of cardiopulmonary arrest. Second, basic life support. Third, advanced life support. Fourth, blood gas monitoring as a component of advanced life support. And then finally, things that we can do in practice to prepare for a cardiopulmonary arrest. Recognition of cardiopulmonary arrest in an unresponsive patient usually focuses on 3 things, your ABCs. It's important to remember that ABCs is for recognition of cardiopulmonary arrest, not for the initiation of interventions for patients with cardiopulmonary arrest, as CPR is not done in the same order. So for your ABCs, the first thing you'll examine for a patient is their airway to look for any upper airway obstruction. Next, you will look to see if the patient is breathing. However, agonal breaths are not included as breathing, and if a patient is agonally breathing and has no palpable pulses, CPR should be initiated. And finally, circulation. So examining a patient's palpable pulses or palpable apex heartbeat to see if there are signs consistent with arrest. It's important to remember that pulse palpation, at least in humans, is notoriously unreliable, and it is usually safer to administer CPR if uncertain.